Guys, I thought I would make a video talking about the supplies needed to do a bladder insufflation, and I was given this information by a medical doctor, so I just thought I would pass it along in case it could be helpful to anyone. So you can get most of the supplies on Amazon, and I would just get a plastic bin like that from Walmart to keep them in, and then you have a nice little work surface anyway from that. So you'll need these pads. um, I accidentally got a huge size, 23 by 36 inches, which is the large, and they're so big I just cut them in half. So you could get a smaller size or just get those and cut them in half. So you'll use that underneath all your supplies. You need sterile gloves, which you can find on Amazon. If you're allergic to latex, they do have latex-free sterile gloves. You need your catheter, which I was only able to find at a couple of the ozone generator manufacturers. These I got from Longevity because they were cheaper than anywhere else, if you buy them in bulk especially. But it has to have this luer lock end, and these are about, I think, 12 inches long, roughly, give or take. So you really do need that length. I was able to find some 6-inch ones with this end online, and they were much cheaper, but they don't work. They're just not long enough to do this treatment. So sadly, I've had to kind of bite the bullet and pay the premium prices that these generator places are charging. But the size is 14 French, I believe, and they told me that that's the standard size for catheter, but you can get smaller sizes than that if this freaks you out. It doesn't cause me any pain, so I haven't bothered to switch, and I think it's maybe more expensive for the smaller size too, since they're not standard. But call your ozone manufacturer or the generator manufacturer and see what they have. You need some lube for the tip of the catheter, so you can get this on Amazon. Surgical lubricant, sterile, bacteriostatic means that it won't grow bacteria inside the lube, so it's not going to foster an environment to grow bacteria in your urethra. Or you can use some ozonated olive oil that you would also want to get from one of the manufacturers. I just get it from Longevity because that's where I got my machine, but the other ones have it too. It has to be this super ozonated kind that becomes thick like Vaseline, and yeah, it has so much ozone in it that it really smells very strongly. And if you have problems with your urethra, then that's a good way to deliver ozone directly into a hard to treat area. And it'll stay there even after you're done with your ozone insufflation because of the olive oil, and it'll continue to ozonate that urethra, although it is incredibly stingy and burns to have it there, so I don't actually use it anymore. You need some iodine swab sticks, 3 swabs in 1 pack, Amazon. You also need some syringes, or you can use the bags that came with your machine to hook up to the catheter to deliver the ozone to your bladder. But I find that to be wasteful of the bags because they're so huge, and you're only going to put in, I would say, between 60 cc's and maybe 200 cc's into your bladder, because any more than that and it starts to put so much pressure, like the ozone gas puts so much pressure on the walls of your bladder that it's really hard to retain the treatment. You just want to, you feel like you have to pee so bad, and it's really uncomfortable. So I do 2 of these syringes, so I have 120 cc's in my bladder, and then I retain it for up to 15 minutes. And these are disposable. I get them on Amazon, and I only use them 1 time because of that, but they work well. Just fill them with the ozone, and then you hook them up to the end of the catheter here, and you just inject it into your bladder, and then you refill it with more ozone and do it again. So those are the supplies I use. And then you need a mirror to be able to catheterize yourself. And then I also use a journal to write down the date that I did it, and the gamma, how many cc's, and how long I retained it, and then any info that might be helpful, like if it was particularly stingy or a lot of pressure that time. So those are the supplies for now, and then you need obviously your ozone generator and your oxygen tank with the regulator. So I will make another video describing the process.